A single unsettling discovery is making headlines in North Idaho. Traces of measles, one of the most contagious viruses known to humans, have appeared in local wastewater. This revelation has sent ripples of concern through the community, especially as Idaho hadn't reported a single official case this year. But here's where it gets controversial. Does the presence of measles in wastewater mean the disease is quietly circulating, or is it merely a scientific blip with no real risk? Dr. Hahn, an epidemiologist at the Idaho Department of Health and Welfare, emphasized that while they suspect someone in the Coeur d'Alene area may have carried the virus, tracking down the source or confirming active cases is nearly impossible. We really don't know if the person was asymptomatic, had just mild symptoms and skipped seeing a doctor, or was simply passing through from neighboring states like Montana or Washington, or even Canada. Hahn explained, there's also the possibility that the individual returned home elsewhere before seeking medical attention, potentially leading any official diagnosis to be registered outside Idaho. This uncertainty has huge implications. Although both Montana and Washington have logged 10 to 49 confirmed cases this year, Idaho officially stands at 0. Yet, wastewater testing, a relatively new tool in the epidemic fighting toolkit, doesn't directly translate to a reported case. It's unclear whether we're seeing evidence of just one person or more, said Hahn, highlighting both the power and limitations of environmental surveillance. And this is the part most people miss. Many Idaho towns don't even conduct this kind of wastewater analysis. Only Boise and Coeur d'Alene actively test for measles, leaving significant gaps in state-level disease detection. Wastewater Scan, a national system run by Stanford University, detected measles for the first time in the Coeur d'Alene Water Resource Recovery Facility on July 29, with follow-up tests showing slightly elevated levels just days later. However, before you panic, it's important to note that the measured concentrations remain low. Just 2 out of 5 samples in a 10-day window came back positive. A key detail, and one often misunderstood, comes from differentiating the type of measles found. Dr. Hahn pointed out that the detected measles is a wild strain, not the virus used in vaccines. The measles vaccine contains a weakened, live virus. After vaccination, some people might shed a trace of this vaccine strain virus. But the tests here have identified wild-type measles, which is more concerning since it naturally circulates and causes outbreaks. So, what should parents and travelers do right now? With schools reopening and vacations looming, Hahn urges everyone to revisit their vaccination status. The measles vaccine is impressively effective, usually conferring lifelong immunity with just 2 doses. The first at age 1, the second before kindergarten. No recurring booster is required. Have doubts about your immunization history? It's perfectly safe to repeat the 2-dose series or undergo a blood antibody test for peace of mind. Search for those old records. You might have them stashed away. And make sure you're protected, especially if you're traveling abroad or work in healthcare, Hahn recommended. But here's another point that's up for debate. Idaho's immunization coverage isn't perfect. Data from the most recent National Immunization Survey suggests that roughly 80% of kindergarteners received their shots last year, meaning about 1 in 5 children might remain vulnerable. Is that enough to keep outbreaks at bay? If you think you've been exposed to measles or experience fever and rash, health officials strongly advise staying home, isolating yourself, and contacting your healthcare provider for further instructions. Simple actions like this can dramatically reduce transmission risk. Measles isn't just Idaho's concern, it's surging in other parts of the country. The CDC recently announced the highest case count since the disease was declared eliminated in the U.S. in 2000. Most recent outbreaks spring from a Mennonite community in West Texas and have spread to surrounding states, often affecting those who didn't get vaccinated. This brings us to a critical question. Is under-vaccination fueling these outbreaks, or are there deeper societal reasons at play? Wastewater testing, despite its imperfections, has proven invaluable for public health. As Hahn colorfully put it, it's like our canary in the coal mine, signaling that measles hasn't vanished. It's still circulating. So what do you think? Should Idaho invest in broader wastewater testing statewide? Is the reported vaccination rate sufficient, Or does the state need a renewed push for immunization, especially as measles makes an unsettling comeback nationwide? Drop your thoughts below. Does this new data change the way you think about your own health decisions, or do you see it as scientific overkill? Spark the conversation. Your perspective matters.